Good morning, and welcome back to one of our webinars in the series of Pulling Back the Curtain. Today, we're going to talk about Medicare. It's about a 25-minute presentation, and if you've got questions, we're going to record this. So if you've got any questions, just type them in the chat, and I'll try and answer as we go along, or we'll get them at the end. I'm going to start with giving you an overview of how Medicare works. First of all, you have to decide. There's kind of three levels. You have to decide whether or not you're going to take Medicare, and there are three kinds of people that are eligible for Medicare, and those are the people that are turning 65, people that are under 65 that have a disability, and those folks with an end-stage renal disease. So those are the people that are typically eligible for Medicare, and so you have to decide whether or not, on a high level, if you want to take it. Usually, if you're aging into Medicare, you're turning 65. Do you sign up, and when do you sign up? Well, you don't have to sign up if you're still working and your employer has more than 20 employees and you've got what's called creditable coverage. So if you have that, you may want to compare what your benefits are to what you can get with Medicare. Sometimes it could be less expensive, because employer plans may have more benefits because they cover more kinds of people, and they may have benefits that you don't care about and you don't need anymore. So if you're eligible, if you're turning 65, we'll talk about the times you can sign up. There are, when you're originally turning 65 or you're originally being eligible for Medicare, you've got an initial enrollment period, which is 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. And if you don't get in at that time, then you either have to wait for the general enrollment period, which is January 1st through March 31st, or a special election period, which are periods, for example, like if you don't take Medicare right now when you're working and you decide to retire, then you've got up to 8 months after you retire to sign up for Medicare. So those are the three general periods that you have to sign up. I always encourage people, if you're turning 65 and you're eligible for Medicare Part A, which is hospital insurance, it's free. Typically, if you've worked 10 years, 40 quarters, and if it's free, why not sign up? Now, the only time you wouldn't sign up actually is because if you've got a health savings account, an HSA, there are income tax penalties if you have an HSA and you sign up for Medicare. So if you have an HSA, that's a reason not to sign up for Part A. And if you decide that you do want to sign up, you want to stop any contributions to an HSA, at least probably 6 months before, so you don't get hit with any penalties for an overlap. And again, that gets into, well, why do I care about when I sign up for Medicare? Well, if you don't sign up when you're first eligible, then there are penalties for not signing up for Part B and Part D. And so we're going to talk about what is Medicare, and that's got a whole bunch of rules associated with it. For example, the enrollment periods and the eligibility. And then if you decide you're going to sign up for Medicare, then you've got two routes to go. You either can go with an Advantage plan or a supplement plan, and they each have separate rules that apply. And then once you decide what kind of plan you want, then the third step is, well, what insurance company do I pick, and who do I use to help me get through the maze and answer all of my questions? So with the slides, you're going to go through the details. But again, do I want to take Medicare, and what is Medicare? There's the original Medicare is Part A and Part B. Part A is hospital insurance. So if you go into the hospital, that's what Part A covers. Part B covers medical benefits like doctors and physical therapists. And they each have different deductibles. If this isn't confusing enough, for Part A, the hospital insurance, and the slides you're going to have this, but I use the slides more to fill in the details, but I think a quick summary overview is helpful. If you go into the hospital, you have Part A coverage alone and nothing else, you're going to have a $1,556 deductible for the first 60-day benefit period. And so you can have more than one benefit period. So if you go into the hospital and come out and you're out for 60 days, then you can have another benefit period. So it's $1,556 for the first benefit period. If you stay in the hospital longer than 60 days, you're going to have a copay for days 61 through 90. And if you stay in beyond that, for 91 through 150, those are your lifetime reserve days, 60 your lifetime reserve days. You're going to have another copay per day for that. So it can be pretty expensive if all you have is Medicare Part A alone for hospital coverage. But Part B that covers the physicians and physical therapists, like I said, outpatient durable health equipment, and you're going to have a 20% co-insurance with that. The Medicare is only going to cover the first 80%. And then you're going to have 20%, and you're also going to have a deductible with that of $233 in 2022. And these deductibles change every year. So Medicare alone is not going to be enough. And again, if you don't enroll with Part B, there are penalties in Part D, and we'll talk about that in a second. But Part B, if you don't enroll when you're first entitled to, when you're first eligible, and you don't have a good reason, like you're going to continue to work and you have creditable coverage and your employer has more than 20 employees, you don't have to enroll. But if you work for a company, for example, that has less than 20 employees and it's not really creditable coverage, then you have to enroll, or there's a 10% penalty on top of whatever the premium is for every 12 months that you don't enroll. So if you miss 12 months, your premium is going to be 10% more forever. And so if you miss 2 years, it's 20%. All right. So that's a reason to make sure that you enroll at the right time. And if you're not sure if you have creditable coverage or not, you want to ask your employer. And then Part D is prescription to drug coverage. That's not really part of original Medicare. Original Medicare is Part A and Part B. And you can see from the deductibles and the copays, that's really not going to be enough. And that's where we're going to talk about, well, how do you fill in those gaps? Part D is prescription drug coverage, and that comes with another separate premium if you have original Medicare. If you go to an Advantage plan, prescription drug coverage usually is included. We'll get to that in a second. But if you don't sign up when you're first eligible for a prescription drug plan, then you're going to have a 1% per month penalty for as long as you haven't enrolled, that you should have enrolled, and that's forever. So those penalties are what usually drives people to be concerned about, do I sign up or not? So once you've decided, okay, I am going to sign up, and you understand what A and B covers, well, how do you fill in those gaps? You have two different routes you can go. You can either go with an Advantage plan or a supplement plan. Two different routes. If you go to the Advantage plan, the Advantage plan will fill in a lot of gaps, but you're going to have co-pays and co-insurance and a maximum amount of pocket with an Advantage plan. And usually the Advantage plans, actually, they're private insurance companies that take over the role of Medicare. So you're not going to give your doctor your Medicare card. You're going to give them your Advantage plan card. And there's a lot of good things in there, with some things that, there are pros and cons to all of this. But with the Advantage plans, you're going to have, again, co-pays, co-insurance up to what's called a maximum amount of pocket, which can be $7,000 to $8,000 a year. And you're going to have your premiums, although you can get zero premium Advantage plans. That's a reason to go down the Advantage plan route. In fact, that's one of the big reasons that people choose an Advantage plan, is because it's got low premiums, but you also have networks. So some people think it's a detriment, some people don't, but you have to stay within that group of doctors. If you don't travel a lot, it may not be a problem. If you develop something like cancer and you want to go to the Mayo Clinic or Houston's the cancer clinic, you may not be able to go there. So that's a kind of a highlight overview of Advantage plans. Now, or you can go the supplement plan route. One more thing about Advantage plans: you can only get into those in certain periods. During your initial enrollment period, 3 months before you turn 65, the month you turn 65, and 3 months after. You can also join an Advantage plan during the annual enrollment period, which is October 15th through December 7th. Then during the general enrollment period, if you have an Advantage plan and you changed your mind, you want to switch back to a different plan, or you want to switch to original Medicare, you can do that during the general enrollment period, also called the open enrollment period, from January 1st to March 31st. And then you can do a change during a special election period. Okay, now that's the Advantage planner. If you want to pick a supplement, it's very important. Supplements, can be very good. In fact, I think supplements are they're great insurance. They're not necessarily cheap, but they're great. But they have their own enrollment period, and that's for the first 6 months after you are eligible. You have to enroll in a supplement, and then there are no medical questions asked. Now, there's no medical questions asked essentially for Advantage plans, but if you don't take a supplement when you're first eligible during the first 6 months you're eligible, then you have to medically qualify, and that can be problematic. With supplement plans, you can change the supplement plan at any time during the year. You can't do that with Advantage plans, but with supplement plans, you can change any time during the year, any month. But after the first time, after your first enrollment, you may have to go through medical underwriting. So that's the problem. So why do you care? What's so great about supplements? Supplements, they're also called Medigap policies. Medigap policies fill in the gaps of Medicare. They cover essentially everything that Medicare doesn't cover. Depending on what plan you pick, there are 10 options. Plan G is, we think, the best. Plan G will cover all of the gaps in original Medicare plus some additional coverage. They won't cover, I don't know why, but for some reason they're not allowed to cover the $233 deductible for Part B. But if you go into the hospital, essentially, if you've got a supplement plan, you're going to pay your supplement, you're going to pay your Part B the premium, which, if you sign up for A is free, right? The hospital is free if you've worked 10 years or 40 quarters. B, you're going to have a premium, $170.10 a month this year, unless you have high income. If you're a single person, you make more than $91,000 a year, then there's a thing called IRMA, income-related monthly adjustment amount. So as your income goes up, Part B, that premium can go up as well. All right, so that's something that you have to keep in mind. So you'll always have, if you sign up for Part B, you're going to have that premium. Then if you take an Advantage plan, again, it could be zero, or you could get very good coverage for $35 a month. The supplement plans are more expensive. You might pay, depending on how old you are, and if you're married or not, and if you're male or female, you're going to get a premium for that right now is going to be just called between $100 and $150 a month. Now, keep in mind, supplement plans, there are 10 different kinds, 10 different options. The government sets the options. They say, okay, if you want to get a supplement, you can take A, you can take B, you can take N, you can take K, L, you can take G. Again, G is the best. Everybody that has a G is a G is a G. You're going to get exactly the same coverage. Okay, so you really want to look at the premium when you're picking a supplement plan, and you want to look at the experience of that company. How big is the company? How much experience do they have in that in that industry? Because they may have a great premium this year, but if they've got a lot of claims, next year your premium may go up substantially. And again, as long as you stick with that company, then you're fine. But if you decide you want to switch supplements from one company to another, you could have to go through medical underwriting again. Okay, but so you're going to pay more. You're going to pay your Part B premium, plus you're going to pay your supplement premium if you take a supplement. But it's got great coverage. It covers. And there's a slide here where we'll compare the things that it covers, but it fills in all the gaps. What it doesn't have is it doesn't have vision. It doesn't have dental. It doesn't have hearing. Now you get some of those bells and whistles to a certain extent covered with the Advantage plans. You don't get that with a supplement plan. Supplement plan is great health insurance, but it's not. You'd have to get a separate plan if you wanted vision or dental, and also you have to get a Part D plan, which it's really not that expensive. But I mean, it's going to have a premium of $10 to say $40, and then you're going to have some co-pays for your medicine, which is going to depend on the tiers. With Part D and the plan, each plan will have a formulary that has what drugs it covers, and for certain generic drugs, it may be no premium, or maybe no copay, or maybe $1 or $2. But as you move up in tiers to brand drugs that are specialty drugs, you're going to have a higher copay. And Part D also has a deductible, just like A had a deductible, B has the $233. Part D has a deductible for 2022 was 480. I think it's moving up a little bit for 2023. And the Medicare plans are coming out right now. We're all getting recertified. We get recertified every year, and we'll have in the next month or two what the plans are going to be for 2023. But Part D will have a deductible, and you'll have your copays until you get to again what's called it's not maximum out of pocket, because there's really no maximum out of pocket with Part D. You get to the point where it's catastrophic coverage. So you'll have deductible called around $500, and you'll pay 25% of whatever the fee is until you get to be about $2,200-$2,300 yourself out of pocket, and then you reach this thing called catastrophic coverage, where you can pay the greater of the copay or 5% of whatever the drug cost is. That's Part D. Now, if you go with an Advantage plan that has a Part D in it, and most of the Advantage plans has Part D, that there's not a separate premium. The premium is built into whoever it is, and so you want to take a look and decide when you're picking programs, again, what drugs do I have, what doctors do I have, and that's what's going to drive a little bit about of your decision about which plan do I take, because you want to make sure, obviously, that your drugs are covered and your doctors are covered, which can change every year. So the plans can change every year, and your medicine can change every year. So those are considerations in whatever plan you pick. But so, again, once you decide, am I going to take Medicare? Which way am I going to go? Advantage plan or supplement plan? Then there are a ton of programs. There's probably 40 to 50 different insurance companies that we deal with that have different programs. They'll have different Advantage programs. They'll have different supplement programs. And then again, if you do the supplement route, you're going to have to add a Part D coverage. And if you want to get vision and dental, that would be a separate policy too. So that's the kind of high level overview. And I'm going to pull up my PowerPoint, and we're going to run through these slides, but I think you're going to probably just wind up hearing this pretty much twice. Okay, so again, let's see, I think we've got about 40 slides here, but we'll go through these pretty quickly because I just covered pretty much everything that's in here. So again, what are we talking about? A and B, that's original Medicare. Part C takes the place of A and B. So it's from a private insurance company, Aetna, Humana, United Healthcare, which is ARP also. Then Part D, you have to be concerned about, again, if you're going to get a supplement plan, then you're going to have to add a separate prescription plan. We talked about Medicare supplements, and they're also called Medigaps. And every industry has its own terms and lingo, and Medicare is no different. And so we're going to go through, again, deductibles, enrollments, Part A, Part B, and what we have to tell you is that this is just for educational purposes. We can't discuss any specific plan benefits, and we're not endorsed by the U.S. government or federal Medicare program. Everybody's got their favorite book from this year, Medicare and You, which is about 130, 140 pages. Got, I think, about 9 different sections, which it's not bad, but it's kind of high level, and it's got good definitions in the very end of it. So if you have nothing else to do, you may want to at least leaf through that. It'll have a section on Advantage plans, supplement plans, Part D, and you should receive, if you actually are on Social Security, you'll get your Medicare card automatically. So if you were disabled before you're 65 and you got Social Security that you're receiving, you'll actually get a card. And if you don't want Medicare, you have to actually unenroll. So, but this is what your card would look like. It's got your name, number, and the dates that your coverage for A and B started. Okay. And the maze that we're talking about. Again, who gets Medicare? 65 or older, under 65 with disabilities, anybody with end-stage renal disease. It's administered by CMS, and you have to get A and B. You have to either be a United States citizen or lawfully present in the United States. Medicare is not Medicaid. Medicaid, you have to qualify for. You have to have, you have to qualify financially uh, with resources. You can't have more than a certain income. You can't have more than a certain amount of assets. Medicare, you pay for during your working years out of your FICA taxes. Part of it goes to Social Security. Part of it goes for Medicare. I think it's 1.45% of the income of your income goes from you, and 1.45 goes from your employer. Again, what's original Medicare? Where did this all start? A and B is actually what's defined as original Medicare. And if you have this, it's not enough. You're gonna have deductibles and co-insurance and co-pays, and you're gonna have to fill that gap. Part A, again, hospital coverage. You have to work for 10 years or 40 quarters. If you didn't work, you can actually pay for it. It's not cheap though. It could be $400, $500, $600 a month for Part A. What's it cover? You get a semi-private room, meals, general nursing, hospital services, and it does not cover the first 3 pints of blood. You get inpatient mental health care for 190 days for your whole life. It covers the first 90 days. After 90 days, you get 60 lifetime. After you get the 60 lifetime, that's 150. That's it. So you used up your coverage, but the benefit periods renew every quarter. So it's unlikely you're ever going to run out. It doesn't cover private duty nursing, doesn't cover private rooms, doesn't cover your telephones or televisions. And there are the gaps that I told you about for the first 60 days. Okay, it's called a 60-day benefit period. So you can have more than one. It's 1556, and then days 61 through 90, it's 389 a day. You're going to have 778 if you get into the lifetime days. It doesn't cover the first 3 pints of blood. Comfort and convenience items. Oh, if you go into a skilled care facility, you have to go into rehab, it'll cover the first 20 days. They usually try and shoo you out of there after a couple of weeks. But Medicare will cover the first 20 days, and then after days from days 21 through 100, you have a copay of $194.50. Again, supplement policies can take care of those copays. The advantage plans, you'll have copays and co-insurance up to a maximum out of pocket. So there is a cap. But skilled care nursing homes, it's not really covered by Medicare. It's covered more by Medicaid, and we do that kind of planning too. What's Part B covered? You're going to have a premium. Remember, $170.10, unless you make more than, if you're an individual, make more than $91,000 a year, you're going to have IRMA. So you'll pay more in that premium. If you get Medicaid, the Medicaid program will probably pay part or all of the Medicare premium. Part B, it's optional, kind of, sort of. Again, why isn't it exactly optional? Because if you don't sign up when you're supposed to sign up, if you're working and you've got an employer with more than 20 employees and you have creditable coverage, you don't have to. You can wait 10 years and not sign up. But if you don't have creditable coverage, and COBRA, by the way, is not creditable coverage. The Affordable Care Act, if you have that kind of insurance, that's not creditable coverage. You have to sign up for Part B, or if you don't, for every 12 months you're eligible, but don't sign up, 10% penalty forever. When can you enroll? I mentioned these periods before. At the initial enrollment period, 3 months before you turn 65, the month you turn 65, and 3 months after. You really want to sign up before you turn 65, because if you sign up in the 3 months before any of those months, you're going to get enrolled on the first day of the month you turn 65. If you sign up after you turn 65, the month you turn 65, if you sign up then you'll get eligible the next month. But if you sign up the month after, or the second or third month after, you're going to be more delayed in getting. So you could have a penalty if you sign up in the third month after you're eligible. You might actually wind up having a penalty. So you won't really want to make sure that if you're thinking about signing up, sign up early. You also can sign up during a special enrollment period. Again, if you lose your coverage, voluntarily or not, you quit, or the company goes out of business, you need to have proof of the creditable coverage from your employer. So again, you may want to reach out to HR and make sure that you know how to get that. And the other time you can enroll is the general enrollment period, January through March 31st. If you don't enroll until that general enrollment period, your coverage only starts July 1st. So you could have a gap in coverage. Again, best time to enroll, initial enrollment period. Annual deductible, $233 for 2022. Copays, 80/20. So you're going to pay 20% of whatever the insurance is without a cap if you don't have anything to fill in Medicare. And we just beat this thing to death here, don't we? So you can sign up 3 months before, 2 months before, 1 month before you turn 65, the month you turn 65. Okay. If you sign up the month you turn 65, your coverage starts 1 month after. If you sign up 1 month after you turn 65, it starts 2 months after, 2 or 3 months after you turn 65, 3 months after. So you could have a gap. And we talked about the lifetime penalty, and again, the same thing. We're doing just the initial enrollment period. Another slide that tells you, here's your month that you're going to turn 65. So if it's April, you can sign up in January, February, March, right? Part D, we talked about, you're going to get it one of two ways. Either if you go through a supplement route, and you want prescription drug coverage, and if you don't want it, you don't have to get it. But again, remember, if you don't enroll when you're first entitled to it, you're going to have 1% penalty per month forever. Or you can get it through your prescription drugs through your Advantage plan. And that's another reason why you want to try, when you're trying to choose a plan, some plans may cover your drugs. The plans are supposed to have drugs that cover every kind of tier, or not tier, but if you take a certain drug, the plans are supposed to give you options that if it's not your particular drug, another drug that does the same thing. So that's one of the reasons why you might pick one plan over another. Who's entitled to Part D, the prescription drug? Well, you have to be either entitled to Part A, so you can qualify but not necessarily sign up for Part A, or enroll in Part B. So you're going to really have to have Part B to get Part D, and these are all designed around service areas. So if you are traveling a lot, this could present an issue, but you have to get the plan in the area where you live. Okay. Talked about waiting, and again, Part D, you're going to have the deductible. Again, in 2022 it was $480. 2023, I think it's going to be a little over $500. And then you have, it used to be called a donut hole, but behind the scenes it's kind of got fixed. So just think of it as you have to pay your deductible unless you have an Advantage plan or a supplement plan that covers the deductible. This is just original Medicare. And then you're going to have 25% co-insurance up until the time you and the company, you and the insurance company, pay $7,050 out of your pocket. And if you do the numbers, that means you come out of your pocket around $2,200. And then you get catastrophic coverage where you're going to basically pay 5% of the premium for your drugs. Okay, and we compared a little bit in the overview. Do I take a supplement plan? Do I take an Advantage plan? The supplement plans, again, there's 10 different ones, and there's basic A, B, K, L, and G is the best. And there's actually, if you don't want to pay as much of a premium for Part G, which we think is best plans, G has a high deductible option. All right. And if you stay with if you have a group coverage, you may want to get, through your employer as a retirement plan, you want to check those too to make sure they're creditable. Not all retirement plans are creditable, but assuming it is, you might be able to get a supplement to fill in the gaps for that. And then there's the Advantage plans. If you get Medicaid may pay some of your premium or all of your premium for the Advantage plan, but you're not going to have so many options. With supplement plans, here's something that's really important. If you have a supplement, you can go to any doctor that takes Medicare any place in the United States. Any doctor, any hospital, anywhere. Supplement plans travel very well. If you get the Part G plan as the supplement, it actually covers what are called excess charges. So there's Medicare assignment and doctors that just accept Medicare. So a doctor may say, well, I'll accept Medicare, but not assignment. If they don't accept assignment, they can balance bill you for 15% more than what Medicare covers. Part G covers that excess charge. Okay, again, another reason if you're thinking supplement, you want really good health insurance. It doesn't come with vision, dental, hearing, but you're going to have whatever your premiums are, and the $233 deductible is pretty much going to be everything that you pay. But you can go to any doctor, any place in the United States. Advantage plans, you can have an HMO or a PPO, and the HMO, everybody knows what an HMO is. It's a network. It has a gatekeeper. You have to have a referral for a specialist. If you have a PPO product, preferred provider organization, you can go outside of your network, but you could have to pay higher or more out of pocket. So those are the more popular ones. Medicaid programs are usually stuck in the HMO. Supplement plans, like I said before, there are different plans, 10 different plans. They've got certain features, and they're all exactly the same. So if you get a G from Humana, it's going to be the same as a G from United Healthcare, the same as a G from United of Omaha. They're all the same. And again, we hit this over and over. Sometimes people say there are 9 plans, depending on how you count. If you count the high deductible or not, there's 10. And here are the plan types. So you count them with me. 1, 2, 3, 4, 5, 6, 7, 8. And then there's 9, 10 over here. But these plans aren't available anymore. If you don't have a C or an F, you can't get these anymore. But you can get a high deductible G. So, what's covered if you take a look, G. Medicare supplement, the G plan is going to cover the co-insurance for Part A, the co-insurance for Part B, right? The first 3 pints of blood, hospice care, co-insurance, skilled nursing facility co-insurance. Remember that, $198 a day after days 1 through 20. The deductible to $1,556. See that? Now it does not cover the D, the Part B deductible. Covers the excess charges. Remember, if doctors accepts Medicare but not assignment, and it has certain foreign travel emergency coverage. Okay, so if you take a look, that's why G we think is the best plan. You can't get these over here, C and F, unless you were eligible before January of 2020. We have plans, 7 different carriers, 47 different plans in Allegheny County alone, and Butler and Westmoreland. We've got, you can see there's lots of choices for Medicare Advantage plans. We've got plenty of providers, and you pick again based on who your doctors are, what your medicines are, and of course the premiums and the maximum out of pockets will vary too. Election periods for Medicare Advantage plans. Remember, I told you Advantage plans have certain periods you can enroll. Supplement plan you can enroll anytime. Basically, you got to enroll in the first 6 months for a supplement plan, so you don't have any medical underwriting. But you can change plans with the supplement anytime, any month. Advantage plans, you got to sign up either during your initial election period, the annual election period, October 15th through December 7th, the open enrollment, January through 31st. But you have to already be pretty much enrolled in a Medicare Advantage plan to change. And then if you have a special election, if you move, if you lose your job, that's a special election. So you can sign up for coverage then too. Supplements versus Advantage plans. Again, we've gone over this. Any doctor, any hospital that takes Medicare, which is practically everybody in the United States, you got networks with Advantage plans. Pretty much no co-pays. You're going to pay your premium, Part B premium. You're going to pay the supplement premium and the $233, and that's it. You're going to have shared expenses with the Advantage plan. You're going to have a Part B deductible, which we just talked about. The Advantage plans may cover your deductible under Part B. Okay, you may have a 0 premium and no deductible Advantage plan. So these, what's not to like about this, right? It's cheap, compared to this, but you're gonna, if you use your plan, you could pay a lot more with an Advantage plan than a supplement. You have to add prescription drug coverage with a supplement. Usually the Advantage plans will have a supplement. And the reasons why you pick one over the other down at the bottom: freedom of choice, no co-pays, no referrals required. But the Advantage plans, you got a network, lower premiums, and it's pretty simple. People are typically used to using a network. What do you pay? Again, Part A, when you have a supplement, it's free either case, as long as you've worked. All right, 170, you're still going to have your 170/10 for either plan, Advantage plan or the supplement. That's for the Part B. You have to pay to get into the game. Part G is going to vary, the premium's going to vary depending on what company you pick. Again, they're all the same, whatever supplement plan you pick. So you take a look at the premium and the experience of the company. The Advantage plans, you could have zero premium, or you could get a very good plan for 35 or 50 bucks. You have the deductible with with a supplement. You you may not have any deductible with, remember I told you Part D with an Advantage plan. You will have a payment for a Part D premium with a supplement. Again, I think we've hit this over and over again. When do you enroll in Medicare? Again, if you're still working and you've got great coverage, you don't have to worry about it. If you're collecting Social Security, you're going to get automatically enrolled, right? And you may have to unenroll yourself. So the decisions you make, do you stay with your group coverage? You can compare your group coverage to what it would be with Medicare and see if you got better coverage or less expensive. Odds are your group coverage, if it's creditable, is probably going to be better. You're going to probably want to stay and not leave the insurance, and you'll just delay your enrollment. No penalties, no loss of options, as long as you've got creditable coverage. And then if you do leave your employer group, do I enroll in Medicare? And then if you decide yes, then do I get a gap or an Advantage plan? Again, if you're collecting Social Security, you're going to get automatically enrolled. If you're not collecting Social Security, you can enroll yourself. If you're turning 65, you can go to ssa.gov. Now, you're going to have a My Social Security account if you're going to enroll yourself, and you want to start this early. And if you do it yourself, print out the page that shows that you enrolled. So if down the road there's ever a question about your coverage and the government wants you to pay a penalty, make sure you print out the page that shows that you've got coverage. You can also go to a Social Security office if you can get into one, and they can enroll you there. You can do it over the phone. Online is probably the best, but you got to watch because they actually ask you a bunch of questions when you're enrolling, and they pull a credit report and they'll start saying, well, did you ever have a Buick, a 2012 Buick? Did you have a Mercedes Benz? And if you don't get the questions right, you can get stuck, and it's problematic. Good sites, Medicare.gov. Once you're on Medicare, this site will give you all of your doctors, all the medicines, all of the visits and treatments that you've had. This gives you a good place to look if somebody says, well, did you ever see this doctor? You can go here and it'll tell you under your Medicare account what coverages you've had. Again, My Social Security, you get Medicare through Social Security. So you don't go to sign up for Medicare through Medicare, you go to Social Security. It's the government. What can I tell you? Then where do you go for help with all this stuff? There are people that will call you, or the television commercials say, hey, well, come to us, and they give you an 800 number. You don't know who these people are. If the same person is going to be there tomorrow, you don't know what expertise they have or what support you're going to get. You go directly to an insurance company. You go directly to, UPMC, Highmark, Humana. They're going to tell you everything that they do. They're not going to tell you about anything else, any of the other competitors in the plan. So they're going to be selling their own plans. Now, if you go to somebody like us, we don't care what plan you pick. We have, plans from many different companies. We've been in the business for a lot of years. So we've got access to all the different information. We'll let you compare the options and you pick. You tell us what's important to you, and we'll try and find the options to work for you. And if you have questions during the year, you're going to be able to find us, and it's just not going to be, well, the operator 234 is no longer here, and they're looking on the screen and trying to find out what you've done before, and how much effort are they going to really put into that? So this was the maze when we came in, and hopefully it's gotten to be a little better. Then just a few more things about what we do. We've got exclusive technology so that if you tell us, here are my doctors, here are my medications, here's what I take, here's how much I take, how often I take it, we can plug it into our technology and it'll tell you what plans are available. And you can, it'll tell you the premiums. We can actually tell you what your drugs are going to cost for the whole year if you tell us what you're taking. Again, why would you pick us? We don't charge anything. And we get paid by the carrier, and so everything that we do is free to you, and we like to think that we give you unbiased information. Do you have any questions? Are there any questions out there? Okay, so how to reach us? Here's a blank slide. So if you want to reach me, actually this presentation will be available on our site next week, KeithEliou.com, under archived webinars. And but if you want to reach me, Keith at KeithEliou.com is one email that you can reach me on. You can call me 412-921-7100. We'll get rid of this. So thank you very much for attending. Again, this will be on our website next week, and hopefully you found some of this informative. And if we went through this too quickly, again, you can replay it at your leisure, probably by the middle of next week. So with that, I'm going to say goodbye until our next presentation in 30 minutes on another topic. So thanks very much. Thanks, Bob. I appreciate it. Hope it was helpful.